old. I should get a new battery. Okay, we're back on.
Okay. The goal is that we want to get rid of the problem. A lot of people want to put an intervention there. It's not an intervention. The goal is to get rid of the problem. And if you just write that and you keep that in mind, you probably won't make that mistake. I want to get rid of this problem. So the goal is two parts. It's time specific and it's measurable. So if my problem is immobility, the goal is to get rid of the immobility problem. Would you agree? All right. Now, I'm going to say the patient will be able to ambulate 15 feet twice by the end of my shift. That's the goal. That's a short-term goal. Okay? Two parts. It has to be time-specific, and I have to be able to measure it. If I am the oncoming nurse and I've admitted this person, and I said, well, my goal is to get them to walk, and it's not specific as to how far, and it's not specific to when, if I am the next nurse coming on, how will I know if that's been met or not? I wouldn't, right? Am I losing anybody? This is a little tricky, it's a little complicated, and really what you have to do is work with it. But the goal is to get rid of the problem. It's got to be time specific and it's got to be measurable. That's the two things the goal has to be. Then you go down, and a short-term goal should never be longer than your shift, by the way. If it's pain, when do you want it to happen? What? As soon as possible is a great answer, because I've seen people put the goal is that I'm going to be out of pain, or my pain is going to be a 0 to 3 on a 1 to 10 scale by the end of your shift. And I said, well, if I'm your patient, I don't want you to be my nurse. If you're going to wait 12 hours to get me out of pain. You follow me? So it's really specific to what you're saying. Now, a goal by the end of the shift to ambulate, that's reasonable because it might take a while to be able to get them to go 15 feet. But if it's something like pain, you know, you want it done within about 30 minutes, right? It's 30 minutes of me giving something for pain, I want that pain level to drop. Does that make sense? And when you really get into advanced med-surg or med-surg, you start talking about airway breathing circulation or circulation airway breathing, you want it done in a second or two, right? You don't want this, you know, because they're going to be dead if you wait till the end of your shift. So the goal, you've got to be reasonable in your thought process as to when you think you can accomplish this. And you have to be able to measure it. Therefore, the next nurse coming on would be able to identify, since it's measurable, has it been met yet? Okay? And then a long-term goal is something that you might want them to accomplish before they're discharged, before they go home. Okay? A nursing intervention is a bunch of parts as well. This, ladies and gentlemen, is where you're going to write how you're going to get to that goal. This is where you're going to write, how am I going to accomplish this? And it's divided into three major areas. What you're going to monitor or observe for. We need 2 or 3 of those things. What you're going to assist or do. We need 2 or 3 of those. And then at least one thing that you're going to teach. You should always teach. Something you're going to teach. Collaboration you might use. I mean, this is immobility, right? What can I use for a collaboration? Physical therapy. I'm going to collaborate with PT, so that could fit in there, right? So, when it comes to monitoring, it's what are you going to monitor? I'm going to sit, I'm going to watch, I'm going to look. Okay? And then when it comes to but if you sit and you look, and you monitor, and you look, I'm your nurse. Brenda, here I come. And you're immobile, and I'm going to monitor, and I'm going to look, and I'm going to monitor, and I'm going to look. Am I doing anything?
No.
Do I actually have to put my hands on Brenda and do something?
Yes.
Yes. You can monitor and look somebody as they die. has to be an intervention point where we put our hands on it and do something, right? All right, that's why these two parts are very important. I can't just arbitrarily come in and without thinking and put my hands on without knowing what's going on. I do have things I have to monitor and watch for and observe for. That's very important. But I also have to be able to intervene and put my hands on them and do something to get that goal met. Does that make sense? So we need 2 or 3 things that you're going to monitor for, 2 or 3 things that you are going to put your hands on them and do, and at least 1 thing that you're going to teach them. And if there's a collaboration piece, you can write that as well. Of what? For in mobility. All right, we got the person. She's got RA. Our goal is that we want her to ambulate 15 feet twice by the end of your shift. So what think you guys that you're going to monitor for? Yes?
Pain level.
You can monitor pain level, but be very careful you're not going off onto another problem, which would be pain. Okay. What else? Monitoring the risk of falling. Yes.
Gravity tolerant,
Oh, well, so you want to observe their range of motion. Okay, that's good.
activity tolerance,
You want to look and see what their activity tolerance is. Okay. So do you see all these things you're monitoring? Yes.
We monitor if they're willing to actually do the step, or if they're holding back.
Their emotional status, you can monitor that. If they're, if they just don't touch me, it hurts all the time. All right, now what are you going to do? You're going to put your hands on, you got to do something. I got to reach this goal, I got to go do something. What am I going to do? Well, nutrition will be another problem. So we don't want you to mix up the problems. Okay, that's why I'm trying to keep you separate. Nutrition is another problem. Pain is another problem. I can assist them with the range of motion. If I can monitor the range of motion, I can assist them to do the range of motion. Do you see one is monitoring and one is doing? And that's perfectly fine, yes.
What
What
about
else?
making sure, if they're not getting out of the bed, making sure they're turned every couple of hours so they don't have like skin breakdown?
But that's not going to help me reach that goal.
Oh,
It's just
okay.
turning them.
I would say assisting them to a chair, helping them get into a chair, maybe with some sort of assistive device.
Okay, helping them get up with an assistive device.
It could be a walker, it could be different things that you're helping them and teaching them how to use.
Okay, good. And that is a teach. That's absolutely a teach. Another teach could be you're going to teach them the dangers of immobility to hopefully encourage them that they want to get up. Okay, yes. Not so much. Okay, it depends on what the assistive device is. If they start to use something like a walker, then you can call the doctor and say, I want an order for a walker.
Collaborative call PT.
For that, to get an order to bring in physical therapy, I would call the physician and say, I need to bring in PT. And they're going to give it to me. That's fine, but that can be a little sticky, especially on questions you're going to see on the NCLEX. What she says is encouraging family members to come. And that's fine, really, in a way, but don't ever pick the answer where you're giving away your responsibility. You can't give away your responsibility to families.
I mean, like say, if they're really discouraged, they do not want to get out of bed. But if you
If they have, but then it goes into a whole lot of merit of, do they have a good relationship with their family members?
Okay.
I don't know.
Okay.
All right, so do you,
Assisting with elimination, and we're not in a freeze, so we get to maybe a site remote if they can't walk over.
then that's the problem of incontinence.
Like, we try that somewhere to do.
provide appropriate footwear.
Yes. non-skid footwear. All of those things are things you're assisting with, all right? So, and you see I kind of steered away from nutrition, from pain, from constipation. Those are separate NANDAs. Those are separate problems. Not to say they don't play into this. We know they do. I've already told you that with one medical diagnosis, I can come up with 5 nursing diagnoses. So, okay, we've taken care of immobility. Now let's do another one on the same woman on constipation related to immobility as evidenced by, okay? The goal is that the patient will have an evacuation on my shift, at least one, okay? And then your interventions for that. What was it, nutrition? Nutrition less than, okay? Related to whatever. It could be the immobility, yeah, and then that's your intervention, is the high fiber diet and stuff. Are you following what I'm saying? Pain. Let's do pain. Nursing diagnosis. Pain related to inflammation of the joints, as evidenced by don't touch me, I hurt. Swollen and painful and red joints. That's objective, you can see it. Your goal, patient will, the patient's pain will be 0 to 3 on a 0 to 10 scale, 30 minutes after I administer pain medicine. Okay? And one of the things, you can use your doctor's orders, by the way, under interventions. And please use them. I mean, if you're talking about pain, one of the things I want to do, of course, I got to monitor their pain, right? I got to put it on a pain scale. I have to do all that kind of stuff. One of the interventions I would like to do is give the pain medicine. Right? So yeah, you can use your doctor's orders under interventions. That's how you're going to get to meet your goal. Do you see how these are done? NANDA is 3 parts. The NANDA, the related to, the evidence by. The goal is 2 parts. It has to be time specific and measurable. You have to have 2 or 3 things you're going to do, you're going to monitor to reach that goal. You're going to have 2 or 3 things that you're going to actually assist with and do so they can reach that goal. And then you need at least 1 thing to teach. With pain, it could be, I'm going to teach the patient not to wait till the pain gets really severe to call me. I'm going to tell them to call me, when the pain begins, so that I can intervene and give them the pain medication early instead of waiting till it's really bad. All right, so now if I told you that you have 1 patient for the rotation, but yet I told you that you have to write maybe 5 or 6 NANDAs, do you see how you can do that with just 1 patient? Okay? Do you see why I told you with this guide there are certain ones you need to stay clear of? You don't know enough yet to write one and be able to defend it and back it up that are medical surgical problems, obstetrical problems, pediatric problems, or psychological problems. You don't know that yet.
We'll break before you get to rationale.
To what?
Well, before you go on to rationale, I'll do a break. Are you ready?